Welcome back to Therani, I'm Joe B. In this video, we'll be answering the question, how do you properly get in and out of bed after a posterolateral hip joint replacement? Let's dive in. After a posterolateral approach total hip joint replacement, there are certain hip precautions that patients need to follow to prevent loosening of the new hip implant or the endoprosthesis. This includes no hip flexion past 90 degrees, no pivoting outward or inward, and no hip adduction past midline. There's also a proper way of getting out and getting in bed. This is called assuming the diagonal position. To attain this, the first step is to place the hospital bed in its lowest position and also activate the max inflate button to make the bed firm enough for ease of bed mobility. The patient's starting position should be in supine with head in neutral, arms at sides, and feet at a hip width apart position. If the patient had a right total hip replacement, getting out the right side of bed will be better. For a left total hip replacement, getting out the left side of the bed will be better for less leg travel time. To assume a diagonal position, the non-surgical hip, in this case the right hip, moves to the left first. Followed by the surgical hip. In this case, it would be the left hip, because we need to get out onto the left-hand side of the bed for less leg travel time. Once both lower extremities has moved, then the trunk moves to the right, and then the steps are repeated until the right shoulder has reached the edge of the bed. Right hip moves to the left, left hip moves to the left, and the right shoulder moves to the right. The process is repeated until the right shoulder is in line with the right side edge of the bed. From there, the patient grasps the side rails or the edge of the bed to pull himself up to long sitting. From there, the patient continues the process until short sitting to the edge of the bed is achieved. Once the short sitting is achieved, to get back in bed is just a reverse process. Patient leans back and slowly assumes a diagonal position. And slowly gets back into a supine position. If you like this video, please like, share, and comment. And for more therapy animations, please subscribe to Therani.